For our first Boots on the Ground fieldwork assignment, Team Awesome met with Lisa Keel, a prevention specialist and counselor with the University Health Services Health Promotion Program. We were lucky enough to observe her working at a conference for high school counselors held at the East-West Center, where she provided informational brochures and pamphlets concerning the variety of services provided by the Health Promotion Program. The goal of the Health Promotion Program is to provide health education and brief intervention services to the students and faculty at the University of Hawaii at Manoa in order to maintain a healthy student body and campus community. The Health Promotion Program has instituted several programs, including the Brief Alcohol Screening and Intervention for College Students, Beat It, and the Manoa Alcohol Project, which provides students with the knowledge and tools required to make informed lifestyle decisions about alcohol and tobacco use. The Alcohol and Other Drug Education Program provides short-term intervention services to individuals at high risk for alcohol and drug abuse in order to prevent the negative health effects associated with their use. In addition, the Health Promotion Program has established the Lokahi Program, which trains peer educators to provide group presentations to their fellow students. According to Ms. Keel, the Lokahi program is an especially important component of the Health Promotion Program because she feels that it is the most effective means of increasing awareness of health issues prevalent in the student community. All programs offered by the Health Promotion Program use surveys and questionnaires to gather surveillance data, and the statistics are used to tailor the outreach activities of the program. This data is then shared with funding agencies and other national organizations whose goal is to address the problem of alcohol use and abuse on college campuses. The Health Promotion Program also works with other departments within the university, such as Housing and Judicial Affairs, University Counseling Services, and ASUH, to implement and enforce university-related health policy and regulations. For example, Ms. Keel is working with ASUH on a resolution to designate the University of Hawaii at Manoa as a tobacco-free college. Most recently, on Tuesday, November 20th, Ms. Keel and the president of ASUH, Richard Mizusawa, were scheduled to meet with the newly appointed UH Manoa Chancellor, Tom Apple, to discuss strategies for implementing tobacco-free initiatives here on campus.
We had the opportunity to meet with Linda Green, Hawaii's Heart Disease and Stroke Prevention Program Coordinator. This program is funded and directed by the CDC. It integrates the Healthy People 2020's objectives for heart disease and stroke. The program aims at reducing cardiovascular disease risk by reducing obesity, diabetes, high blood pressure, and high cholesterol. Instead of focusing on short-term objectives, the program focuses on policy and system changes in priority settings. Hypertension is currently the primary focus for the program. This figure represents the prevalence of high blood pressure in adults by demographics such as gender, ethnicity, education, income, and county. Looking at the figure, we see that Japanese, Native Hawaiian, and Filipino populations must be targeted to reduce their blood pressure to meet the goals of Healthy People 2020. Manual blood pressure readings are the gold standard in healthcare. However, healthcare professionals are rarely retrained on how to properly take a manual blood pressure. Patients can be misdiagnosed if proper technique is not applied. One intervention for high blood pressure is to retrain healthcare professionals, such as physicians and nurses, on proper techniques for taking a manual blood pressure. It is expected that once retrained, they will return to their medical practice and retrain their staff and integrate a policy and procedures on the proper technique for taking a manual blood pressure. We met with Dr. Sarah Park, Hawaii State Epidemiologist. Her title is the Chief of Disease Outbreak and Control Division. She is responsible for organizing, directing, and securing funds for the Infectious Disease Division, not including TB and STDs. Dr. Park also acts as a liaison with the CDC, distributing assessments and data requests to the appropriate divisions. Hawaii is one of 12 states that function with no local health department. In states that have both a local and state health department, the state will act as a mini CDC, while the local department performs the groundwork collecting data. In Hawaii, the state collects the data, analyzes it, and relays it to the CDC. Surprisingly, the state does not conduct any research. Research is often costly and a luxury that the state can't afford. Instead, the state performs assessments. These assessments will eventually lead to prevention measures. Dr. Park also shared with us some of the difficulties in epidemiology. In the example of a suspected outbreak, there can be up to a 2-week time lapse between specimen collection and identification by the state's lab. Once a case is identified, investigators interview the case, usually through the phone. A long time lapse can cause difficulties for the case to recall events that occurred. Investigators also face difficulties in persuading cases to participate in interviews, as they can often take a long time to complete. One disease that Dr. Park is currently working with is called angiostrongyliosis, also known as rat lungworm disease. It is predominantly occurring on the Big Island. Rat lungworm disease is a parasitic infection in rats. The intermediate host is a mollusk, snail, or slug. The rats consume the infected mollusk, snail, or slug, and the parasite thrives in the rat tissue. The parasite is excreted through the rat droppings and consumed by another mollusk, snail, or slug, continuing its life cycle. Humans can become infected if they consume raw or undercooked infected mollusks, snails, or slugs. However, the parasite cannot survive in human tissue. It travels around searching for a suitable environment, usually the brain. It causes damage to the human tissues and commonly eosinophilic meningitis. At this time, there are no serologic analyses available to diagnose an infection. Instead, diagnosis is based on symptoms and patient history. Treatment is supportive. The state investigated the cases and wrote a descriptive epidemiology paper. They were able to identify common social characteristics in those who were infected. They identified a population who was at high risk of becoming infected. Interventions are aimed at educating the public and preventing the consumption of raw or undercooked mollusks, snails, or slugs.
I'm Julia Chose. I'm a public health epidemiologist with the Hawaii Health Data Warehouse, and my responsibilities are to help maintain the Hawaii-specific health data for use by the community and by the Department of Health and students. And then also to work on a syndromic surveillance system for the state that would hopefully alert us if we saw an abnormal number of certain type of symptom come through.
I'm Ranjani. I'm a chronic disease epidemiologist with the Hawaii Department of Health, and I'm also the manuscript editor for the Hawaii Journal, one of the manuscript editors for the Hawaii Journal of Medicine and Public Health, and I try to help with providing chronic disease data for all of our chronic disease programs and assisting them with their data needs.
Hi, my name is Tanya Lowry St. John, and I'm the Science and Research Group epidemiologist for the Department of Health. So I head up the Science and Research Group, which includes the Behavior Risk Factor Surveillance System, the Hawaii Health Data Warehouse. We also do the youth surveillance for the state, which is the Hawaii School Health Survey, so both the Youth Risk Behavior Survey and the Youth Tobacco Survey. Ranjani is also in charge of the analysis for the Safety and Wellness Survey for the state. So we do a lot of different surveillance work, but a lot of what we focus on is trying to help turn that data into information to help do program planning and program evaluation and try to decide where we'll put resources to work on different issues.
For our fourth fieldwork assignment, Team Awesome had the opportunity to meet with three fantastic epidemiologists, Tanya Lowry St. John, Ranjani Rajan, and Julia Chose. We were able to conduct a roundtable interview to discuss the work they do as epidemiologists, as well as some of the challenges they encounter in their work. Tanya Lowry St. John is the Science and Research Group epidemiologist for the Hawaii State Department of Health and a co-editor for the Hawaii Journal of Medicine and Public Health. Ms. St. John discussed several surveys conducted in Hawaii, including the Behavioral Risk Factor Surveillance System, or BRFSS, and Hawaii Youth Surveys. The BRFSS is an ongoing telephone health survey system, and in 2011, surveyors managed to contact approximately 7,600 Hawaii residents to inquire about their health risk behaviors, preventative health practices, and healthcare access primarily related to chronic disease and injury. Surveys targeting individuals under the age of 18, including the Youth Tobacco Survey and the Youth Risk Behavior Survey, are also conducted annually. These surveys sample 1,400 middle school students and 1,400 high school students, totaling 2,800 public school students, and contain questions concerning high-risk behaviors that can lead to premature death, such as alcohol and drug use, violence in the home, physical activity, nutrition, and healthcare use. Community meetings are held every year to determine the types of questions to include in these surveys. Several challenges arise when conducting these surveys. For example, data on height and weight of middle school children is scarce or unreliable, in part because middle school children often lack the ability to accurately self-report this information. Health officials are attempting to remedy this problem by using legislation to mandate that the Form 14, which is required when the child first matriculates into the public school system, usually in kindergarten, and includes data such as height and weight, is completed again before the start of middle school and high school. Ranjani Rajan is a chronic disease epidemiologist with the Department of Health and a co-editor for the Hawaii Journal of Medicine and Public Health. Ms. Rajan spoke at length about the challenges of data collection, namely the difficulties associated with obtaining good data. She explained that surveys must be designed in a manner that provides clean data, and that this includes creating questions that can be easily understood by the participant so that they can respond appropriately. Survey questions must also be structured in a manner that allows the desired data to be collected. The participant's response rate must also be taken into account. Often, investigators must double or triple their initial population sample so as to obtain an adequate amount of data that is truly representative of the population in question. In addition, data can be collected in different formats and its quality can vary depending on its source. Consequently, data must be cleaned and standardized prior to use in a research study. Julia Chosey is an epidemiologist for the Hawaii Health Data Warehouse. The goal of the Hawaii Health Data Warehouse is to provide data to support public health professionals, the community, and health agencies to become more effective in the application of health data. It was created through the partnership between the Hawaii State Department of Health and the University of Hawaii's John A. Byrne School of Medicine in order to address and monitor the Healthy People 2010 goals. The website for the Hawaii Health Data Warehouse is provided at the bottom of the screen. Ms. Chosey is also working on what she calls the syndromic surveillance system. Hospitals statewide will electronically submit all their emergency room intake forms to the Hawaii Department of Health, and the syndromic surveillance system will gather this data and run it through a series of algorithms to detect patterns. This allows health officials to quickly and efficiently detect disease outbreaks. Unfortunately, the system does not provide patient identifiers, which delays the efforts of epidemiologists trying to identify the cases and the environmental conditions associated with the outbreak. In addition to their individual projects, Ms. Rajan and Ms. Chosey are collaborating on a project to more fully integrate the objectives of Healthy People 2020 into programs administered by the Hawaii Department of Health. In order to do this, they met with different programs such as the Hawaii chapters of the American Cancer Society and the National Kidney Foundation to identify each organization's priorities for combating chronic disease in Hawaii. After gathering data, they made recommendations to the Department of Health on which objectives should be selected for tracking. In addition, all the objectives selected for tracking must have a prevention program already in place so that progress of meeting the objectives can be monitored. Ms. Chosey was also responsible for creating a Healthy People 2020 tracker, which is available online at the Hawaii Health Matters website. The website is provided at the bottom of the screen. Here you can see which objectives were selected for Hawaii and where the state stands in meeting these goals. Team Awesome thanks the audience for the opportunity to share our experiences with you. We would also like to say a big thank you to all the public health practitioners and epidemiologists that shared their time and knowledge with our team. We learned a great deal and had a lot of fun along the way. Mahalo nui loa.